Okay, good morning everyone. Today we will continue with our presentation on the size of the chest. Today will be the third part and we will continue from where we left last time. This appearance is called acinar nodosa or acinar rosette sign. Okay, what you see here is this appearance of like centrilobular nodules. It is very similar to tree in bud. You remember from last time the tree in bud appearance? It's the same thing, but the nodules are not very well defined. They are ill defined. Okay, you can see here. Also, you can see here just like some sort of tree in bud. This is what's called acinar rosette sign. What happens is that these nodules are, this is a bronchogram, this is a normal bronchogram. You can see each bronchiole and terminal bronchiole is ending in multiple alveolar sacs, and each one is forming this thing that's called what? Lobule. This is a lobule, okay? It's a polygonal space that contains a terminal bronchiole with multiple alveolar sacs or alveoli, and when this is filled with any material, whether fluid, blood, inflammatory, malignant cells, this will lead to this appearance of centrilobular nodules or the acinar rosettes. You can see it in, like for example here, and what happens is if you focus really carefully and you see these lobules, you just divide them in your mind into different lobules. At the center of each one you'll see a small ill-defined nodule, sometimes well defined, but usually it's ill-defined nodule that represent the alveolar airspace filled with something, filled with a material of some kind. Okay, so this indicates an airspace process. Okay, the lung is composed of two parts mainly, the airspace and the interstitial part. The interstitial part is these lines that separates the lobules into different compartments. Okay, while the airspace is the part that contains the air that we breathe. So the processes in general are either interstitial or airspace. Okay, for example, when we say consolidation, we means the airspace is filled with fluid that makes it opaque or white or dense. Okay, when we say interstitial fibrosis, reticulation, interstitial fibrosis, this means that the interstitium is affected, not the airspace part. Okay, yeah, the part that's responsible for oxygen and the carbon dioxide exchange is the airspace. Okay, now the next sign here is the what's called the split pleura sign. This is a very easy sign, let's say, very well known, and we recognize it easily in daily practice. What we have here is this is a pleural space. Okay, there are two layers of pleura, of parietal pleura, and between them is a fluid. What happens there is the pleura is thick and enhancing. It appears here thick. You can see, we don't see normally we don't see the pleura like that, thick and enhancing, and contains some fluid here. So this indicates what? Most of the time it's empyema. Okay, also can be seen with the pleural tumors. The pleural tumors you can have the same appearance. Sorry. No, this is visceral and parietal. Okay, well, just I will show you here. This is an enhancing separation of visceral and parietal pleura. It's also, as we said, common in empyema and with the pleural tumors. The visceral pleura is the one on the surface of the lung, and the parietal pleura is the one that is covering the chest wall from the inside. Okay, so You can see here it is thick and enhancing. Sometimes might contain a few air bubbles also, especially if previous intervention, for example aspiration, chest tube, things like that, can or air forming organism can gas forming organism can, you can see a few air bubbles. Okay, any questions? تمام. Another example of the split pleura sign. Examples, you can see here the pleura is not the pleural fusion here and the chest x-ray is not what would you expect normally. The meniscus sign is not very well defined when you see pleural fusion in a normal, in for example heart failure. Okay, when you see pleural fusion, there is a meniscus sign. You know this sign that you see the pleural fusion silhouetting the heart and the diaphragm. Here the pleural fusion is not forming a typical meniscus. It is more encapsulated, loculated. Okay, it's located in a certain part of the chest. Okay, this, when we take a CT scan, you can see that the pleura is thick and enhancing. Okay, indicating it is an empyema. It is an inflammatory reaction of the pleura to the presence of pus, making it loculated in certain part of the chest, not like pleural effusion just flowing everywhere, forming the meniscus sign. Everything is good. Again, some silly signs to be aware of. This is beware the cow will knock you down. And for the next 88 kilometers, be careful of kangaroos and I don't know, this camel or something. Okay, and here they're just the children and the koala. There should be the same thing. Anyway, the next sign is what's called the CT Hallow sign. Okay, CT Hallow sign. What is seen here is there is a nodule, okay, with a peripheral increased opacity. It's like a halo. When we take 5 days before, the CT scan 5 days before, it was more well defined and the halo is not very well seen. So what's this CT halo sign? This is the halo that we mean like in saints and things like that. They have a halo, or angels around their around their head. It's a ground glass opacity surrounding solid nodule, very suggestive of invasive aspergillus. But should it be in the correct clinical settings? Someone with appropriate history. Not wherever you see it is just aspergillosis. You should have a proper clinical settings. Okay, for example, you can see here this nodule with surrounding ground glass opacification. Also here there is nodule with surrounding ground glass opacification, and here with surrounding glass opacifications, multiple. Before they develop, at the beginning it was like that, and then it progressed to this. Okay, so this is the CT Hallow sign. You have two CT scans. One is not very well seen CT Hallow sign, and the second, after a few days, it's progressed and the patient is febrile, is deteriorating. In a correct clinical settings, this indicates a CT Hallow sign. Okay, good. The next sign is what we call it CTangiogram sign. Okay, CTangiogram easily defined as the presence of enhancing branching pulmonary vessels in a homogeneous low attenuating consolidation. When you have, for example, this consolidation, you can see the vessels inside it as linear enhancing structures. You can see these lines containing contrast, IV contrast. These are the vessels, the pulmonary vessels against a consolidated lung. Okay? So, These enhancing branching pulmonary vessels in a homogeneous low attenuating consolidation of the lung parenchyma relative to the chest wall musculature. Supposedly, it's very suggestive of bronchoalveolar cell carcinoma, about 92%. But in reality, it's very non-specific.
Also called hepatization of the lung.
Sorry?
Hepatization of the lung.
Hepatization of the lung, yes. However, in theory, has high specificity for a bronchoalveolar cell carcinoma, but in practical, it is not. So don't depend on it. Try to look for other clues that might help you, okay? So we see this sign all the time. If this was specific for bronchoalveolar carcinoma, like most of the people that have CT scans will end up with diagnosis of bronchoalveolar carcinoma, which is not the case. So it is not specific in reality, okay? You can see consolidation, airspace opacification of whatever cause with multiple linear enhancing vessels indicating the CTangiogram sign. Okay, this is very strange sign. Warning, this road crosses US Air Force bombing range for the next 12 miles. Objects may fall from the sky. Okay? Okay, now, this is what's called the continuous diaphragm sign. What does it indicate? Under the, no, not pneumomediastinum, exactly, not pneumoperitoneum. It's there under the cardiac, as you said, not under the diaphragm. This is a whole different thing, okay? So, normally, you see the diaphragm on the left and on the right, but you don't see it under the heart, okay? Because the central diaphragmatic tendon is fused with the pericardium. So you don't see air under the heart, okay? When you see air under the heart, when you see the diaphragm under the heart, that means that there is something between the diaphragm and the pericardium, which is air, that makes it visible. So this is what's called a continuous diaphragm sign. It is a lucent stripe around the inferior border of the cardiac silhouette, which crosses the midline, and it is diagnostic of pneumomediastinum. The air usually comes either from the lung or from the esophagus. Most of the times it's from the esophagus, not the lung. The lung usually causes pneumothorax, okay? Not pneumomediastinum, usually, but it can happen, okay? So, for example, when you see here, this is, for the first look, it looks very nice chest x-ray, just maybe normal. But if you focus really hard, you can see the diaphragm is continuous. You can see it from the end to from the far right to the far left, continuous. This indicates there's something wrong here. There is pneumomediastinum. Another example, you can see here, it's a continuous diaphragm. You should not see this appearance. Okay? Not always. Many of these patients are usually in the ICU, are usually intubated and multiple ECG leads, and usually it's a portable chest x-ray. Can happen in otherwise relatively good patients or healthy patients, but usually it's something like that. Multiple wires, multiple tubes, multiple things, because pneumomediastinum is not something easy to pass, okay? You can see the diaphragm continuous from one side to the other. Other examples, I'm showing you different appearances, let's say. Here,
The first picture also has a sign, previous to slide.
just a second, let's see, sorry, what's going on? This one or this one?
It's called the leaf of jink sign.
Yeah, leaf of, yeah, the white appearance.
Yes, gas is the pectoralis major muscle.
This, you mean the striations, yeah. It's due to the what?
Gas between the
It's due to the surgical emphysema, subcutaneous emphysema. Okay, this leaves of Jane sign. Yes, you are absolutely correct. This, you can see here, it's opaque. It's lucent. It's more blackish in color. Okay, why? This is muscle, it should not be black, should be white, because there's air in the skin, in the subcutaneous soft tissues, as Dr. Serbes said, which is this indicates surgical emphysema or subcutaneous emphysema or whatever you call it. Yeah, the lines, striations, due to the muscle fibers. So back to our topic, and you can see here, this is the normal appearance of the heart. You see the central pulse is not visible. You should not see it because the central tendon of the diaphragm fuses with the pericardium in this part. When you see it like that, okay, especially when you have this appearance, this fine lucent line separating the pericardium from the heart, this indicates pneumomediastinum, okay, or pneumopericardium, whatever you like. Again, you can see it also in the lateral view. Not only, this central continuous diaphragm, you can see it even in the lateral view. If I don't have a case here, unfortunately, but however, if you take it in a lateral projection, you can see the diaphragm to be continuous under the diaphragm. The same idea. So, a new sign here is what we call the pericardial fat pad sign. Some people call it Oreo cookie or sandwich sign. I like the Oreo cookie. So, what does it mean? It's a water density or stripe between two layers of fat. These are the epicardial and the pericardial. You can see here two density. I hope it's well seen on the data show. You can see two densities with two lucencies with a density in between. Okay, this is the pericardial fat pad sign or the Oreo cookie. It looks like an Oreo. Okay, so this is the Oreo cookie that we are talking about. The line in between is the whitish part, the whitish thing here, with two layers of pericardial fat. Again, can be seen here is another example, okay? And you can see it also in the CT scan as two layers of fat with a pericardium in between. It's just indicating a mediastinal fat. So when you see this appearance, it is not something to be worried about, not a big pathology. It's just fat surrounding the pericardium from inside and outside. Okay? A very famous sign we all know about is what's called the double density sign. Okay? So before I show you an example, what's a double density sign? What does it indicate? Come on guys, it's a basic one. When you see a double density sign, what does it mean? It indicates a left atrial enlargement. Okay? When you see a double, okay, so left atrial enlargement means the left atrium is the most posterior part of the heart. Usually it's small. When it enlarges, it makes a big density that's seen behind the heart. It's not, you might not be able to appreciate it in this image, but we will see a lot of examples. Don't worry. We have a lot of explanation to do on this one. So there is something here behind the heart that normally is not seen. And you can see the splaying of the carina, how it's widely opened, because the left atrium is just below it. When it enlarges, it just open it wide, resulting in this appearance of another density behind the heart. That's the double density sign. When you see it, you can be sure of left atrial enlargement. It is white on white opacity over the right side of the heart with it's in the right side of the heart, but it is due to left atrial enlargement. Okay? With this pulmonary angiogram, you can see the catheter is just making a loop due to the presence of a big left atrium here. Okay? You can see there is something here behind the heart. It's the left atrium. Okay? What happens here is the following. In the lateral chest X-ray, let's imagine the lateral X-ray. This is the heart. Okay? The right ventricle is the most anterior one. The most anterior part of the heart is the right ventricle. Okay? While the most posterior part is the left atrium. And that's why we see it clearly during transesophageal echo. When they do transesophageal echo, the left atrium is direct contact with the esophagus. Very close to it. Okay? So, it's like this is the big part of the ball here. And this is the small part of the ball here. Okay? When you see this in face, when you turn it around, what will happen? You'll see this appearance. Just imagine this in face. Okay? You'll see this part, the double density sign. It's density with another more density. It's this heart with the left atrium over it. Okay? Another, to help us understand it to a better way. This is the right ventricle, the right atrium, the left ventricle, and the big left atrium. Okay? When you see this in face, you end up with this, having a density over the cardiac density. Double density sign. Okay? Double cardiac shadow sometimes is also seen. Yeah.
Only the right border of the heart. When you form also the left one, it's called the density sign.
The same principle applies
Yes.
to both conditions. Okay? If you do a barium swallow, just make the patient swallow a barium, okay? And you take a lateral chest X-ray, what will you see? You see this something indenting on the esophagus, okay? Indenting on the esophagus. This is the left atrium becoming large, and sorry, just a second. Something wrong here. What happened? Okay. This is the part of the orange, that the rounded part that is indenting on the esophagus, making this indentation. You can see it on the esophagogram or the barium swallow. Again, you can see here there is density over the cardiac density with the splaying of the crine. If you look it in face, it is the left atrium that is over imposing on the cardiac shadow. Okay? Just to be clear that you understand the whole idea again, it's a density over a density. In the AP view or PA view, sorry, and the lateral view, the esophagus will be indented. You can see it here and here as this part and this part indenting the esophagus. This esophagus is indented here, and you can see the density here. Okay? بعد ما ننساها. I think we can shift to another sign. Any question? Good. Now, air crescent sign. What does that indicate? Mycetome, exactly. Air crescent sign is, at the beginning, this CT scan was presented with this. It's a mass appearing opacity, ill-defined, maybe some speculated borders infiltrating the adjacent. It's very suspicious looking. However, after 5 days, if you look carefully, there is a crescent of air surrounding this opacity. Just an air thin line or rim of air surrounding it. Okay? So, this pattern helps you to determine that this is not a tumor, not a mass, not something neoplastic. It is a descriptive term used in two different aspergillus diseases. Two different aspergillus diseases, which are fungus ball in a pre-existing old cavity, like TB, okay, and early cavitation in consolidated lung in invasive aspergillosis. Both of them are related to aspergillus. One is a fungus ball forming in a cavity of TB, usually in our part of the wall, it's TB, okay? Or just invasive aspergillosis forming a cavitary lesion, cavitating. You can see, for example, here, these are cavities preformed with a fungus ball formed inside the cavity, okay? You can see here this, what appears to be a suspicious mass. If you look carefully, there is a thin crescent of air that helps you to differentiate that this is an aspergilloma, okay? Another example is, you can see it in chest x-rays. Here it's just an area of airspace opacification, maybe ill-defined. There is some linear thing here, not quite sure whether it is there or not. After a week later, you can obviously see that this is a very well seen crescent sign. It's a crescent surrounding the fungus ball, indicating a mycetoma, okay? Again, another example. It was like that. Maybe not very well defined, some might say. Just give it a few days and you can see it here in the lateral view as a much more obvious crescent sign. Just to be sure that you see it, this is in the AP view, the meniscus here, or the crescent, okay, surrounding the mycetoma, and on the lateral view you can see it here. Another example, you can see here an opacification of the right upper lung zone, okay, and there is some thin linear lucency here, which indicates the air around the fungus ball, okay? And when we took CT scan, you can see obviously the air surrounding the fungus ball in a preformed cavity, okay? Another example, if it was in a TB cavity, most of the time it will be in the upper lobe. In our part of the world, as we said, in the Middle East, usually it is TB, okay? So TB usually cavitates in the upper part of the lung. So when you see it more, think more of in the upper part rather than other places of the lung, okay? Now, there is a sign called the upper triangle sign of Filson. Does anybody have any idea what's that? Upper triangle sign of Filson. This is a triangular shaped right paramediastinal opacity seen in the right lower lobe collapse. It is upper, but seen in the right lower lobe collapse, okay? Because the upper mediastinum will rotate in the right lower, in cases of right lower lobe collapse, can be mistaken for right upper lobe collapse or pneumonia. What do you mean by that? What happens is the following. There is a right lower lobe collapse here, okay, silhouetting the right heart border. لحد الآن okay till now? What happens when there is a right lower lobe collapse, the mediastinum will rotate, resulting in appearance of this part. This is not a right upper lobe collapse, it's exactly the opposite. It's a right lower lobe collapse. And that's what we call the upper triangle sign of Filson. Tamam? This is not a real opacity. This is due to the rotation of the mediastinum. And the real one is this one. And it's a right lower lobe collapse, so it's definitely above the diaphragm. And that's why the diaphragm is elevated, because there is volume loss. resulting in elevated right hemidiaphragm and mediastinal rotation, resulting in this appearance. Usually this part is behind the sternum. You cannot see it in the normal person. When it rotates, okay? Exactly. It's a part of volume loss. When you take CT scan, wow, it's surprising. You are expecting to see an right upper lobe collapse, and in fact, it's exactly the opposite. At the upper part, there's nothing here. Upper part of the chest, everything looks okay. When you go down, you see the collapsed lower lobe. Okay? So be careful. Not every triangular thing in the upper part is right upper lobe collapse and it's the golden S sign and everyone is happy, except the patient, well, of course, is not happy. Okay? Tamam. I think we have some time for one more sign. What's called the tapered borders or ball under the rug sign. I think we should maybe leave it here and continue next week. This sign needs some explanation, and there are multiple slides about this. I think we stop here and we continue next time. Okay? Any questions? Everyone awake? ما حد نام? No one sleeping? Good.